Okay, so today we're going to learn how statins work and why are they prescribed in people with high LDL cholesterol. So what happens is in our liver, whenever we eat something, it goes to our liver, as we all know. It gets broken down and we get these little tiny little molecules, which are called acetyl-CoA. Now, acetyl-CoA further gets broken down into HMG-CoA, which is then broken down into mevalonate, which is our precursor to form cholesterol. So what happens is whenever people have high LDL cholesterol, we want to bring that cholesterol down. So the best way to do it is by giving statins. So whenever we give patients statins, it goes and blocks this HMG-CoA reductase. So what happens is when this is blocked, we have less mevalonate being formed, which is the precursor. So when we have less mevalonate, we'll definitely get less cholesterol, correct? So what happens is whenever we have less cholesterol in the cell, we have a checks and balances system in our body, which for this is it's going to be called SREBP pathway. So what it does is it tries to bring LDL back up, and how it's going to do that, it's going to send signals to bring LDL receptors to our blood so that we can get more cholesterol taken up into the cell. So whenever we do have that, it'll catch on. This is our blood. This is our free moving blood. So whenever we have those little particles, it'll catch on, the receptor will catch on, and then it'll bring it into the cell. So in the cell, basically, it tries to reduce LDL from the blood and bring it more into the cell. But obviously, we don't want to increase LDL in the cell as well. So what happens is the LDL, the particles, they go to lysosome, where they get broken down or they get reused. Basically, it's our trash system. Whatever we need, we take it up and reuse it, break it down. If we don't need it, the body just tries to get rid of it. So now we have LDL, less LDL in the blood. Well, why is that important? So what happens is if patients have a lot of LDL cholesterol levels in the blood for longer periods of time, what happens is it ends up forming plaques in the system. So in their blood vessel, people with high LDL cholesterol, what they're going to see is that they'll have little plaques being built up, due to which they'll have hypertension. They can also, if these plaques keep getting worse, they can also experience myocardial infarction or heart attack, which is why it's very important to learn this topic, because statins help lower the LDL cholesterol in blood. Therefore, they prevent more aggravation of these plaques. So what happens is whenever you give statins, it lowers our LDL cholesterol down. Therefore, when there's low LDL in the blood, the plaque will be maintained. It won't get worse. But when you don't have, when you don't give statins to people with high LDL cholesterol, what happens is, as you can see, there's like a lot of particles here that can go and they can get like stuck, and they can just like keep aggravating. And then the more they aggregate, they eventually end up blocking this vessel. And we all know when blood can't go through, the part can become either necrotic, or we can get like an MI, which is a heart attack, which is why statins are helpful in bringing down